We always had a multidisciplinary team on site in St Francis's Special School in Beaufort and Killarney. It's a school that always served the needs of very complex children in the county. At the moment there are 52 pupils on the moderate to profound diagnosis in the school.
All the children in the school have really complex needs. They have they've really specialised requirements, and they need specialised intervention from therapists who are dealing with these children on a daily basis.
I sent Brídóg to St Francis Special School, which is a wonderful school. It has fabulous teachers, it's a fantastic principal, and it's so well run. And the pupils going there are amazing.
All the therapies were on site. He was going to have speech therapy, he was going to have occupational therapy, he was going to have physiotherapy. So we left our meeting with the principal and said, yes, this is the place for our son. It is a very hard decision for parents to make, because you are saying, yes, my child is different, his needs are different, but we felt his needs were going to be met in St Francis.
The place for him was St Francis because of his needs, and we knew the services back there at the time were good. Initially there was all those services, the multidisciplinary team were on site.
Which would mean that you had a speech therapist, occupational therapist, a physiotherapist, a psychologist on site at nearly all times.
Even going back five or 6 years ago, the services would have been, a really fantastic service. Our daughter Georgia is walking now. She's 15. She's walking since she was about 7.5. Without the service and the intensity and the quality of the service at the time, she'd never have walked. She'd still be in a wheelchair.
We got a lot of support from the speech therapist with relation to his swallowing difficulties, and also the occupational therapist would have dealt with his seating, with his bed, and then the physio helped with his overall muscle tone, because he'd have low muscle tone, and that would lead to chest infections if he didn't have regular chest physio or if he wasn't moving enough.
It was massive to the children and the families that when the clinicians were on site, that it was almost organic, that they knew the children so well.
And not only did they know the children and they knew David very well, they knew us. The occupational therapist could pick up the phone, have a chat, how was I doing? She was kind of there for me as well as for David.
As a parent, I sometimes go into the school, I'd bump into the OT, I'd say, how's Georgia doing? And we'd have a quick chat for 10 minutes, and no written reports, no hours spent writing endless, wasteful paperwork. The same with the occupational therapist or the physio, speech and language people. We'd meet maybe in the hallway, or maybe we'd have a cup of tea in the canteen for 5 minutes and just explain what's happening, and is there anything that I, the parent, should be doing, any way we could help. And there was a good communication system.
You could see it was good, it worked well.
Where you have all these people coming together, it was like such a unified approach, and that's what a multidisciplinary team stand for. You take each aspect of the child and you look at it as a whole.
The therapies systems within the county had amalgamated, and everything had changed upside down. So basically what he'd left in Able Ireland didn't exist anymore. There was this new kids set up that was going ahead.
And since reconfiguration of the services, all the clinicians now have been pooled into one pool, and they serve many regions within Kerry, 4 regions.
The team that was there dedicated to the school, and they took them out of the school and they based them in a team in Tralee,
where they spend most of their time behind the desks. Then they've got the travel time between Tralee and Beaufort, which, is another, it's just so much time being wasted.
And they have been just snapped out of a setting that they were really good at, really top notch, and they have been spread across a caseload of 250 children now, and their expertise is being lost as well to the new staff coming in, like the new SNAs, new teachers. They'll never have that chance to be immersed in that pot of professionalism, really.
The HSE's idea of reconfiguration and having a therapist who can deal with a baby to an 18-year-old with a huge range, ranging from very mild disability to very severe disability, is just affecting the quality of the service that's coming into the school, and I'm sure it's affecting the quality of the service in other schools as well. And it just means that our children are not getting anywhere near an adequate level of care, and they need a specialised team for the school.
It's heartbreaking, and it's very hard for the therapists, because they're stuck in the middle. They're getting, they're not getting the hours, and we, the parents, are putting the pressure on them. Why isn't my child being seen?
Jack has a lot of chest problems. Jack has dislocating hip. He has early stages of scoliosis. So physio and OT are very important to him from those points of view.
For the last year or over a year, she hasn't had speech therapy. She might have seen an occupational therapist twice in the last year, and she hasn't had access to a physiotherapist.
It was probably November, December, even January before we met the physio who was assigned to the school. And then when they were assigned to the school, they had limited hours, because they had to serve something like 245 kids in their area.
But nowadays, the service it's practically non-existent. There's George's at presently, she's supposed to be getting physio once a fortnight, one session in the fortnight. Now she isn't even getting this because other complications come in, meetings and emergency cases.
At the moment, there is a name, there's no face. I haven't been in contact with the new occupational therapist. David hasn't mentioned her name, whereas he would have mentioned it to the other girl. I've seen her name in a piece of paper that came home once, and I feel that David is a name to her, not a person, whereas to the last occupational therapist, it was very obvious that she was there for David, for everything he needed.
At this moment in time, it's difficult to track down somebody to get an answer. Their workload seems to have increased dramatically, and they're just not available to the children. There's no consistency as to visits, and the nurses also just a huge issue.
Because Jack needs a lot of suctioning as well. And the facilities, there's nobody in the school to take care of him. I would go on a daily basis to suction him, because otherwise that could turn into a chest infection or pneumonia.
We have had to keep him at home a lot of time though, because we would either feel that if we drive out in the middle of the day and suction him on one occasion, it wouldn't be sufficient, that he'd be a risk of aspirating, ending up with pneumonia and ending up in hospital for weeks. So that's really where the nurse is vital for us.
Jack doesn't take anything orally, he's peg fed. So there's a swallowing issue and everything like that. So again, they should be there with him all the time, and they are not there.
I suppose she's in a relatively good spot at the moment, but without the services she could end up back in a wheelchair, and that is a frightening thing.
My little girl is not toilet trained. She can't put her seatbelt on, and she deserves the chance for these life skills to be taught to her. I do the best I can, but I'm not a specialist educationalist.
It came down to last year, he didn't have speech therapy at all. David's speech is one of his strengths. Children with Down syndrome sometimes would be non-verbal. David is quite the opposite. And we would be very hopeful that he would have the help he needs to communicate, because as a lot of people would say, you can't put a price on communication. And the HSE obviously think you can. Well, in the case of my son, no, you can't. David needs speech therapy. He needs quite a lot of speech therapy.
Stephen went from having physio 3 times a week to I'd say a couple of visits between October and March, and he was in hospital twice in that period with chest infections. So it just had a huge impact on his health, the withdrawal of the service from him.
When they started withdrawing these, then you could see James was regressing bit by bit, and the more services they took, the more he was regressing.
Her posture has deteriorated. Her speech has regressed.
The thing wasn't working at all. It was obviously the cuts. They promised us that the reconfiguration, as they put it, would be this bright, nice, new, shiny answer to all the things. In truth of it, they were just cutting. It was all about money. Cut.
If a physio's got a day and a half a week, compared with we had 2 physios for a whole week before, then the sums are the service can't be provided under the present circumstances. So we need to go back to where we were.
You had the most vulnerable children. Like James, who's autistic. There would be Down syndrome kids there. There would be children with other clinical conditions. Some children that couldn't be fed by mouth and would be getting by tube.
It's always in the back of your mind, your day. When he goes to school, he's happy going out, but your whole day is thinking about, will he be okay till he comes home at 3:30, or is my phone going to ring and I have to run, basically. So there needs to be someone there that you can trust and that can take on that responsibility while you're living the other part of your life with your other kids and stuff like that, and that he's safe.
I just got a phone call an hour ago that he had got a seizure in school. He has uncontrolled epilepsy, so we have emergency medication in the school, which the teachers or the special needs assistants have to give him, and that's not really a satisfactory situation because they're not medical people, and I think it's a big responsibility for them to have to give a medication to a child, and they have no nurse there to give them direction or to give them training or anything like that.
I understand recently there was a child had to be hospitalised. A child, I just happened to be in the car park when the ambulance came in, and things were held up for about an hour while the ambulance came and collected the child and took the child to Tralee Hospital. Now, if there was a nurse on site, there may not have been a need to call an ambulance. We need people. You've got 52 children and every one of them are special needs.
It's absolutely ridiculous and dangerous that there is no nurse full-time on campus. I mean, we deal with consultants in numerous hospitals around Ireland that cannot believe that a special needs school in the south of Kerry does not have a full-time nurse.
You can imagine the lack of security and within the setting now when you have no team on site. It was always a huge backup to the staff there, and we have wonderful teaching staff and SNAs at the school because they have been immersed in years of professional input from the clinicians. Now, when clinicians have been taken away, and they'll dispute the word taken away because they are now based in Tralee and they do come to the school our services have been reduced by 80 to 90%. So it's had a massive impact to the families. They're at breaking point.
It's unbelievable to think that there's not a nurse, even for 1 hour at this minute in time, back in that school with so many children with extra needs. It's disgraceful.
And I am devastated about what is happening to the services for both Breedogue going into St. Francis Special School. We have lobbied politicians to no avail, and I just say shame on you politicians that you can't take care of these vulnerable children. Ireland was always known to be a place that would take care of its most vulnerable, and I can't believe that this is happening to these vulnerable children.
It is David's fundamental right to be educated. The education they are delivering in St. Francis is top-notch, but they are also being hindered by the lack of services.
If Stephen isn't healthy enough to go to school, I have to keep him at home, and which means that he's missing out on his schooling, and therefore he's not having the access to school that he should have. And it's his right under the Constitution to have access to appropriate schooling, and yet he needs intervention by therapists to get access to schooling.
but we are finding the children are being impeded to get their education, to reach their potential, because of the lack of HSE services coming into the school, and they are legally entitled to their education. There was always a respite service for children from moderate to profound services at St. Francis's. There was a respite house called the Arches, and they always had 4 respite beds at the house, so that children from the school they might be lucky enough to avail of 2 or 3 weekends in the year, and their families could do other things with their other children.
It's absolutely so important to have a respite service in place for these children and for their parents. Every help should be given to the parents, really, because we're quite exhausted just taking care of the children.
Most of the children in the school are 24/7 care, and nobody can work for 24 hours, 7 days a week with that much responsibility without some kind of a break.
I think that it's a very complex issue, and it's very hard for parents or carers or guardians, siblings, to say, I really need a break from someone I love, but that's the way it is.
And even if you know you have something to look forward to, even if you know in 2 months' time, I have a whole weekend where I don't have to give the medication in the morning and give the feeds and give the medication at night and be asleep but with 1 ear open in case he has a seizure. That will keep you going.
But now with the last 3 years, respite has more or less dried up. For me personally, James is on a respite list for 3 years, and I have never ever got a day of respite since James started in St. Francis's School, or ever in fact.
About 3 years ago, I just wanted myself and my husband to get away for a couple of days, and I started looking for respite. I've gone to politicians. I was interviewed by a respite care team earlier on this year, and there has been nothing given to us.
David was promised respite. Last November, he had a night in the respite house, and we hadn't heard anything else, so I asked some of the other parents, and it turns out the respite house is now being used as a residential house.
It's absolutely vital that there is a full-time residential house and a respite house in the South Kerry region for these families and for their children, because they need a break. They're entitled to a break.
I want politicians to hear me and to hear that us parents, we're going to stick together and we're going to continue to fight for these children who have no voice, and we want the services restored in the school.
Well, we strongly want, as families of these children at St. Francis's, our multidisciplinary team back on site. We feel this is the way our children can progress in their lives. We feel it's vital.
Ideally, I want the services back the way they were. Obviously, if they could have been improved back then. That's not going to happen, but if they were the way they were when he was 7, I was very happy back then.
So I suppose what we're looking for is full-time therapies at school and full-time nurse.
Even if I never had a special needs child, I would, stand up for these children and fight this campaign, I feel very, very strongly about this subject. Passionate, actually.
It's wrong. I wouldn't, if we saw it in another country, we would be saying, whether it was in Romania under Ceausescu, whatever, we have seen it before. Now we're doing it to our own children, our own vulnerable children. It's wrong, and I want the government to roll back and put back properly what should be there in the first place to look after these children. Like I said, if I never had a child with special needs, I'd say look after them children first.
Bring a smile to your eyes. This time is ours to keep. No need no more to try. Watch the day days roll by, my love, and live our lives to see. We'll face our fates as one, forever you and me.
Enough is enough. I'm standing up for James. Who are you standing up for?
Enough is enough. I'm standing up for Georgia. Who are you standing up for?
Enough is enough.
We're standing up for Jack. Who will you stand up for?
Enough is enough. I'm standing up for Brídeog. Who will you stand up for?
Enough is enough. I'm standing up for Stephen. Who are you going to stand up for?
Enough is enough. I'm standing up for David. Who are you standing up for?
Bring a smile to your